Welcome to the BanishCancer channel. Today's focus is the role of grassroots cancer movements in improving awareness, screening, and access to care. While these efforts originate in communities rather than institutions, their measurable effects have direct clinical relevance: earlier presentations, improved adherence, and reduced disparities. Grassroots movements operate on a simple premise: trusted local voices influence health behaviors. Community health workers, survivor leaders, and faith or neighborhood organizers create familiarity and psychological safety. Patients engage more readily when information is delivered by someone they know and environments feel supportive. This trust translates into concrete outcomes, including higher screening uptake and more timely evaluation for concerning symptoms. Core principles guide effective community action. Care should be accessible to all. Patient and community needs are prioritized, participation is shared across patients, families, and the public, and decisions emphasize living well alongside treatment. When these principles are embedded locally, communities report greater confidence discussing cancer, fewer misconceptions, and stronger links to primary care and specialty services. Community roles are central. Peer champions, survivor advocates, and trained health workers provide navigation, language-appropriate education, and practical support. Examples include outreach in faith settings, schools, and workplaces, and targeted engagements in smaller or underserved groups, where stigma, language, or logistical barriers are prominent. Compared to top-down approaches, grassroots initiatives adapt quickly to local constraints, close service gaps, and reinforce continuity between community and clinic. Public awareness benefits are substantial. Local events, social media campaigns, and storytelling normalize cancer conversations and elevate recognition of early signs. Breast cancer awareness efforts and similar initiatives demonstrate that well-designed, community-proximate messages increase knowledge, prompt screening, and sustain healthier behaviors beyond an event window. These gains are amplified when messages are delivered by trusted messengers and reinforced across multiple familiar venues. Early detection improves when communities receive practical, culturally attuned education. Programs that teach self-exams, clarify when to seek evaluation, and demystify diagnostic steps are associated with higher screening rates and more appropriate care seeking. Men's health outreach in barbershops and tailored education in tribal or multilingual contexts illustrate how meeting people where they are reduces delay, anxiety, and missed opportunities. Reducing barriers to care is a recurring strength of grassroots efforts. Collaborations with local providers, patient navigation services, and use of respected community channels help patients overcome transport, scheduling, paperwork, and financial obstacles. These supports lower missed appointments, improve follow-through for imaging and labs, and maintain connection during treatment. In underserved areas, the effect is particularly notable. Navigation and outreach correlate with more early-stage diagnoses and fewer care interruptions. Several modalities drive engagement. Community meetings and small group discussions establish trust and allow immediate clarification of concerns. Storytelling enhances health literacy and emotional connection, translating abstract risk into relatable action. Social media and local events broaden reach, especially for younger audiences or those distant from clinics. Local partnerships with faith organizations, schools, and small businesses embed messages in daily life and strengthen referral pathways. The impact is measurable. Peer advocacy has been associated with multiple-fold increases in screening in specific programs. Patient navigation reduces no-show rates by meaningful margins. Large, coordinated campaigns have achieved broad visibility while maintaining local relevance. These outcomes align with clinical priorities: earlier stage at diagnosis, improved adherence, and better preparedness for treatment decisions. Despite successes, common obstacles persist. Limited and variable funding constrains program continuity. Volunteer burnout, stigma, myths, language barriers, and transportation or housing instability challenge consistent engagement. Innovative solutions, promotora models, comprehensive navigation, housing stabilization pilots, and training of community advocates address these issues and demonstrate that non-clinical determinants materially affect clinical outcomes. Looking forward, priorities include scaling digital supports, expanding multilingual resources, training more community health workers, and strengthening partnerships with hospitals and local governments. These steps can stabilize programs, standardize referral and feedback loops, and ensure community insights inform clinical pathways and policy. In summary, grassroots cancer movements are an effective complement to clinical care. Trusted local leadership increases awareness and screening, navigation reduces missed care, and tailored communication counters stigma and confusion. For clinicians and health systems, engagement with community partners is a pragmatic strategy to advance early detection, adherence, and equity, moving patients from concern to timely, appropriate care. Thank you for watching the BanishCancer educational channel. Stay informed as we continue examining how community action and clinical practice intersect to improve cancer outcomes.